Let me describe a person. Tell me if this sounds familiar. They take metformin for blood sugar. They take a statin for cholesterol. They take lisinopril or amlodipine for blood pressure. 3 conditions, 3 pills, 3 copays, 3 sets of side effects. And every 6 months, their doctor adjusts the doses, usually up, rarely down. That is not healthcare, that is maintenance. You are being managed, not healed. Now let me tell you about a compound. One compound. It lowers fasting blood sugar, published, peer-reviewed, meta-analyzed across 46 clinical trials. It lowers total cholesterol and LDL cholesterol, same body of evidence, and it lowers blood pressure through a mechanism so elegant that when I first read the research, I sat at my desk for 10 minutes just staring at the screen. One compound, 3 conditions, and the side effect profile in double-blind randomized trials lasting 3 months or longer, comparable to placebo. This is not a miracle herb from the internet. This is a compound used in traditional medicine for over 2,500 years, validated by modern science in some of the most rigorous clinical trials you will find. So why has your doctor never mentioned it? The answer is structural. Medical school does not teach natural compounds. Residency does not cover them. The prescribing software your doctor uses does not have Berberine in the drop-down menu. Insurance does not cover it. And in a 12-minute appointment, there simply is not time to say, have you considered a 2500-year-old Chinese botanical? It is not malice. It is infrastructure. I am going to walk you through all 3 mechanisms. The blood sugar evidence first, then cholesterol, then blood pressure. And at the end, I will give you the exact dosing protocol and the 4 combinations you must absolutely avoid. Here is what most people do not understand. Blood sugar, cholesterol, and blood pressure are not 3 separate problems. They are one problem wearing 3 masks. Underneath all 3 is a single dysfunction, insulin resistance. When your cells stop responding efficiently to insulin, which happens gradually after age 40 and accelerates after 60, 3 things happen at once. First, glucose stays in your blood because your cells will not absorb it. That is high blood sugar. Second, your liver compensates by producing more VLDL particles, driving up triglycerides and shifting your cholesterol profile toward the dangerous pattern. Third, the chronic inflammation damages the lining of your blood vessels. The endothelium becomes stiff and stops producing enough nitric oxide, the molecule that keeps arteries relaxed. That is high blood pressure. 1 root cause, 3 symptoms, 3 pills. What if you could address the root cause itself? What if there was a compound that activates the same metabolic master switch that exercise activates, improving how your cells handle glucose, how your liver processes cholesterol, and how your blood vessels produce nitric oxide? There is. It is called berberine. Let me tell you what berberine is. It is an alkaloid found in golden seal, Oregon grape, barberry, and a Chinese herb called Coptis chinensis. Traditional Chinese medicine has used it for over 2,500 years, originally for diarrhea, a humble beginning for something this powerful. In 2004, a team at the Chinese Academy of Sciences published a study in Nature Medicine showing that berberine lowers cholesterol by increasing LDL receptors on liver cells through a pathway distinct from statins. Then, in 2008, the landmark study, researchers at the Shanghai Institute of Endocrinology published a trial in the journal Metabolism comparing berberine head-to-head against metformin in newly diagnosed type 2 diabetics. The results were remarkable. Berberine reduced HbA1c from 9.5% to 7.5%. And here is the line that made researchers sit up straight. The hypoglycemic effect of berberine was similar to that of metformin. Similar to the most prescribed diabetes drug on the planet, over the next 15 years, the evidence did not weaken. It got stronger and wider. Let me show you how berberine works, one system at a time. Most blood sugar supplements work on the surface. Berberine works at the level of a cellular switch called MPK, your body's fuel gauge. When MPK is activated, it tells every cell, start burning glucose, start burning fat. When MPK is dormant, your cells are asleep at the wheel. Glucose floats around knocking on doors, and nobody answers. You know what else activates MPK? Exercise. Berberine activates that same pathway. Your cells start responding again. A 2021 meta-analysis of 46 trials with over 4,000 participants found that berberine significantly reduced fasting blood glucose, post-meal glucose, and HbA1c. The HbA1c reduction averaged 0.73 percentage points. Many first-line diabetes medications, costing hundreds of dollars a month, achieve reductions of 0.5 to 1.0 points. Berberine sits right in that range, from a plant compound costing $15 to $20 a month. But berberine also reduces HOMA-IR, a measure of insulin resistance itself, not just blood sugar. Your cells become more responsive to insulin. Your pancreas gets to rest, and berberine reduces hepatic glucose output, the glucose your liver dumps into your bloodstream overnight. That is why your morning fasting number stays high even when you did not eat for 12 hours. Berberine helps fix that. Now, cholesterol. Most natural remedies work on one aspect of cholesterol metabolism. Berberine attacks it from multiple angles. Your liver has LDL receptors that grab bad cholesterol from your blood and pull it in for processing. Statins increase these receptors by blocking cholesterol production. Berberine also increases LDL receptors, but through a completely different pathway, by stabilizing the messenger RNA that codes for the receptor. Two different mechanisms, same result, lower LDL. And here is what matters. When berberine is combined with a low-dose statin, the LDL reduction is greater than either alone. A 2008 study in Nature Medicine reported a 46% reduction with the combination, compared to about 27% with berberine alone and 28% with simvastatin alone. That is synergy. But there is a piece most people miss. It is not just about the numbers. When LDL particles get oxidized, they become the form that actually triggers plaque formation. Berberine has strong antioxidant effects that specifically reduce LDL oxidation. It is not just lowering the number of particles, it is making the remaining particles less dangerous. Now, blood pressure. This is the part that surprised me. Most blood pressure medications work from the outside in. They force your blood vessels to relax. Berberine works from the inside out. Inside every blood vessel is a single layer of cells called the endothelium. It produces nitric oxide, the molecule that tells your blood vessels to relax and stay flexible. After age 60, nitric oxide production declines, your arteries become stiff, and your blood pressure goes up. Berberine enhances the activity of the enzyme that produces nitric oxide. More nitric oxide means more vascular relaxation. It helps restore flexibility to your vessels, not by forcing them, but by giving the endothelial cells what they need to repair themselves. In human trials, berberine produces modest but meaningful blood pressure drops, typically 5 to 10 points systolic. For someone with borderline hypertension at 135/88, that drop might be the difference between needing medication and just monitoring. And this benefit happens on top of the blood sugar and cholesterol improvements. So let me put this together. Berberine lowers blood sugar by activating AMPK, enhancing glucose uptake and reducing liver output. Berberine lowers cholesterol by increasing LDL receptors and reducing oxidation. Berberine lowers blood sugar by restoring nitric oxide production. 3 conditions, 1 compound. All 3 effects confirmed in randomized controlled trials. Now, the 4 critical mistakes. This section is not optional. Mistake 1. Berberine plus metformin without medical supervision. Both activate AMPK. Combining them without dose adjustment is like doubling your medication. You risk hypoglycemia, dangerously low blood sugar. If you are on metformin, you must involve your doctor. Mistake 2. Berberine plus statins at full dose. The synergy is powerful, but berberine affects liver enzymes that metabolize statins. This can increase the statin concentration in your blood, amplifying side effects like muscle pain. Talk to your doctor. Mistake 3. Berberine plus blood pressure medication without monitoring. If berberine improves vascular function and you are already on medication, you can end up with blood pressure that is too low. Hypotension in someone over 60 is dangerous. Dizziness, falls. Monitor your blood pressure daily. Mistake 4. Berberine plus certain antibiotics, specifically macrolides, like azithromycin. The same liver enzyme interaction applies. If you get a Z-Pack, your doctor needs to know you are taking Berberine. I am not trying to scare you away. The safety profile in clinical trials is impressive. Most side effects are mild GI issues that resolve within 2 weeks. But safe in clinical trials and safe for you specifically are different. If you are 72 years old on 6 medications, talk to your doctor first. Now the dosing protocol. The most studied dose is 500 mg 2 to 3 times daily. But do not start there. Week 1 and 2, start with 500 mg once daily with your largest meal. The food buffers GI effects and improves absorption. Week 3 and 4, if you tolerate it well, increase to 500 mg twice daily, once with breakfast or lunch, once with dinner. Week 5 onward, if you still tolerate it, you can increase to 3 times daily. But many people see excellent results at 1000 mg total per day. Take Berberine with meals, not before, not after. You want it in your system when the food hits to blunt the post-meal glucose spike in real time. What form, berberine hydrochloride, is the most studied? Look for berberine HCl on the label and third-party testing. Skip blends and complexes. Take berberine alone. What to expect? Week 1, maybe mild digestive adjustment. A slight dip in post-meal numbers, 5 to 10 points. Nothing dramatic. Do not get discouraged. Week 2 to 3, fasting glucose may start dropping by 10 to 20 points. Many people notice better energy and less afternoon fog. That is AMPK activation. Your cells are burning glucose more efficiently. Week 4 to 6, cholesterol changes start showing up. Triglycerides often respond first. Blood pressure improvements may begin. Week 8 to 12, the full effect emerges. HbA1c drops. Triglycerides drop significantly. Blood pressure stabilizes. You walk into your doctor's office with a lab sheet that looks different. Numbers moving in the right direction without adding another pill. Here is my recommendation. Before you start, get baseline blood work. Fasting glucose, HbA1c, full lipid panel. Take-home blood pressure readings, 3 mornings, average them, write it all down. Take Berberine for 12 weeks. Then repeat your blood work. Same tests, same lab. Compare the numbers. If they improved, bring the results to your doctor. Do not argue. Do not lecture. Just hand them the before and after. Let the data speak. I have a question for you. How many pills are you taking right now? Not vitamins, just prescriptions. 3, 5, 7? Drop the number in the comments. One more thing. This video covered what happens during the day, but there is a whole other battle at night. Between midnight and 6 a.m., your liver is producing glucose. Your cortisol is surging. Your blood pressure dips and spikes before dawn. Most people over 60 wake up to a fasting number that makes no sense because they do not understand what their body is doing in the dark. That is why I created the midnight insulin trap. It covers what changes after 60, why your morning numbers stay high, and a simple nighttime system. The link is below. And if this video opened your eyes to what one compound can do, I made another video about the 7 breakfast foods secretly tripling your stroke risk. The number 1 food on that list, I almost did not include it because I knew how angry people would get, but the research was too strong to ignore. That video is on your screen right now. Thank you for watching. Take care of yourselves.